Hello, my name is Adam Foster. I am the Residency Program Director of the PGY1 Pharmacy Residency Program at Advent Health Daytona Beach. I wanted to make this video to be able to provide some additional information about the design of the program, the graduation requirements, what our program can offer you to make sure that your goals and the things you're looking for within a residency program match what we have in our program. So a little bit about me. I am from West Virginia, born and raised, and went to pharmacy school at West Virginia University. I did a couple of my APPE rotations here at Advent Health Daytona Beach, so that is my initial connection to the hospital. And then I did my PGY1 pharmacy residency at Virginia Commonwealth University and Bremo Pharmacy. It was a community-based pharmacy residency program, so I got to do a lot of management, teaching, running clinical services, and be able to learn a lot about transitions of care. So I did my research project on transitions of care and was telling the director of pharmacy at this hospital about it, and we ended up creating a position for me to open a transitions of care clinic at the hospital. That position has evolved over time and become a clinical manager position. Now we have a pharmacy residency program that I oversee, as well as a Coumadin clinic, medication management clinic, and I oversee our medication history pharmacy technician program, and am involved in all sorts of fun projects at the local, regional, and divisional level. So enough about me. We'll talk a little bit about our pharmacy department as a whole. So we have pharmacists in the central pharmacy, and then as well as decentralized throughout the whole hospital in our ICU, CVICU, and our CV step-down unit, medical unit, progressive care unit, and then in the emergency department, we also have an infectious disease pharmacist who you'll hear from shortly, as well as an IV room supervisor who's a pharmacist and has a lot of experience in oncology industry, and then of course sterile compounding. We also have an entire team of remote order verification pharmacists who complete and verify over 90% of our orders, which is very helpful. It allows the pharmacists who are on site to focus on as many clinical level activities as possible. Most of these clinical services that the pharmacists provide are going to be consult based and include pharmacokinetic dosing, vancomycin and aminoglycosides, TPNs, IV to PO conversions, anticoagulant dosing and monitoring, glycemic management with insulin dosing and monitoring, which is something that is specific to our facility. So we allow our pharmacists to be able to be consulted for glycemic management, and then they can basically totally control the entire glycemic regimen for our admitted patients. We also have potassium channel blocker management, formulary substitutions, renal dosing, available as consults that other providers can be able to pull in pharmacy to be able to. All right, in terms of overall program design, you will be completing 6-week rotations throughout the majority of the year. So one day out of every week you will be in clinic with me. So that's something that makes our program stand apart. You get a good mix of inpatient and ambulatory care experiences. Very helpful because you may be on your internal medicine rotation on Monday. That patient can get discharged on Tuesday. Maybe you'll see them in clinic on Friday and really be able to say, wow, this is what happened to that patient I was just taking care of. Be able to pick up on things that could happen after discharge. So then for your next patient next week on your internal medicine rotation, you can proactively identify these issues that could happen. It allows you to be a better practitioner. So that's one thing to keep in mind that really makes our program set apart. But in general, you'll always start with a 6-week orientation period, both residents at the same time, and you work with not only folks here at the local level, but residents and pharmacy leaders across all of Advent Health. So you have a lot of different moving pieces during orientation. You'll have health system training, basic consult training, ALS training, which used to be called ACLS, and then research orientation. There are sessions on burnout, professionalism, and then that's all mainly with folks in the Orlando hospitals. Then you'll come back here and work very closely with our preceptors on consult training, understanding the workflow, the staffing components and requirements, how things move throughout the pharmacy to the floors, who is involved in what, and be able to really be comfortable as much as possible with the staffing component, because it does pretty much spill over into all of the other rotations. So learning from years past, we actually decided this year we're going to add an extra 3 weeks of patient care foundation. So that way we can make sure that you are totally comfortable with the consults that I mentioned before. Then when you're ready to actually start your active rotations, you'll be able to really focus on whatever the subject matter is, instead of having to waste time for the preceptor to say, okay, wait, remember, this is how we do a TPN, or this is how we do a warfarin consult. No, you already have that extra time to be able to be proficient in those areas. So that's something that we're very excited about. During that orientation, you also get training on code blue and stroke alerts and how we complete them at the local required rotations. And then on top of that, if you start to do the math, you realize there's some extra time out of the 52-week year. So we have 4 weeks of our research block, is what we'll call it. And that includes the week of mid-year. It starts at mid-year and then basically runs through all the holidays into the beginning of January. So then by that point of the residency year, you'll already for sure have had your research project designed. You'll have the data collection sheet already designed as well. You'll be able to start pooling data and then start analyzing data. So that time is going to be very important because we want to make sure you have plenty of time to get that research project done. 1 year is not a very long time to do a whole research project, so we're able to bust out a lot of the data collection and analysis during that break from it being on an active rotation. Then if you do the math even more, there's an extra 3 weeks. So then this is going to be 3 week of elective time. So whatever one of the patient care rotations that you've completed before or want to complete, we can give you an additional 3 weeks. So if you're really interested in critical care, then you're going to cover all of the basics of critical care throughout your 6-week rotation, but you want to learn more about neurocritical care in pediatric patients. So then maybe during that extra 3 weeks, we'll do everything we can to give you as much exposure, as many topic discussions, if you want to do a journal club, give you that extra time to have even an advanced exposure to that area that you may be interested in. So that's important to know. One other thing that we have added this year is a nutrition elective. So it would be a 3-week elective, and we would bring in folks from dietary. We work with them closely anyway, but you would work with Cyrene, our critical care specialist, as well as our clinical manager, to be able to learn everything there is to know about enteral nutrition and parenteral nutrition, work with our colleagues, and then do a whole host of nutrition-related concept topic discussions that will make you more whole as that. So then some other components of the program that we need to cover are going to be the pharmacy service commitment. This is staffing. So that's going to be every 3rd weekend plus 15 evening shifts throughout the year. Those are quick to be able to bust out, but gives you an exposure to evening shift because it's very, very, very different than day shift or night shift for that matter. So then we want you to have some kind of built-in exposure. 15 is not a lot to get done throughout the whole year. You'll hear from our staffing component preceptor very shortly. We also have a longitudinal administration learning experience. So there's several different components of this learning experience that, again, are on a longitudinal basis. You're invited to every P&T meeting, but within that longitudinal administration learning experience, you'll actually run one. So making the PowerPoint, doing the navigating through the agenda, doing the meeting minutes, and be able to lead the meeting and make sure it's moving forward appropriately and efficiently, so all of the providers are very happy. So that's a good learning experience. You have to develop one standard operating procedure or work instruction for the local level. You'll be spending time with our executive director of pharmacy. You will alternate leading RAC meeting minutes every other month. So again, having the opportunity to lead meetings and try to rein in all the folks who are in the meeting. You learn a lot by doing that. You review safety events with our clinical manager and operations manager they alternate every month. And then you are assigned kind of ad hoc projects, so you have a better understanding of the level of involvement that it takes to be able to complete some administrative type activity. And then one resident will be the student coordinator for the year, then the other resident will be the recruitment coordinator. So that's the entire longitudinal administration learning experience. On top of that, other components include one journal club or patient case presentation in each of the core 6-week rotations, one formal research project, as we know, that will be presented at the Florida Residency Conference, and then we will pursue publication of the manuscript, one formal medication use evaluation, that's what we present at mid-year, one formal grand rounds presentation, aka a 1-hour CE that will be presented to pharmacists across all of Advent Health. For all those big projects, you'll have a primary advisor, potentially a secondary advisor, depending on what's going on with that project, for each of those projects to help guide you. And we also work with the other Advent Health programs to ensure we have plenty of resources to complete these projects. We also have an optional teaching and learning certificate program that we have added within the last couple of years due to resident feedback. Alrighty, now I'm going to switch it over to some of our preceptors so they can introduce themselves, talk a little bit about their rotations, and I hope you enjoy.
Hello everyone, my name is Cyrene Molineros and I'm one of the critical care clinical pharmacist specialists in the medical ICU and the clinical manager of the pharmacy department here at Advent Health Daytona Beach. We perform daily patient care multidisciplinary rounds Monday through Friday and participate heavily in Code Blue and stroke alerts in the hospital. Additionally, we are avid members of in-house, local, and divisional hospital committees. We also assist the providers with bedside procedures such as rapid sequence intubation. We look forward to seeing you here at Advent Health Daytona Beach.
Hello everyone, I'm Kelvin Gandhi and I'm the Infectious Diseases Clinical Pharmacist Specialist here at Advent Health Daytona Beach. I'm the preceptor for the Antimicrobial Stewardship Rotation, and on a daily basis we collaborate very heavily with the Infectious Diseases Consult Service team, the hospitalists, all the other clinical pharmacists, the microbiology department, as well as the infection prevention team. And one of our main projects for this quarter is reducing C. difficile infection rates. So that is something that we're focusing on, and it would be a pleasure to have you join our team.
Hi everyone, my name is Savannah. I am the internal medicine preceptor. I am from Raleigh, North Carolina. I originally came down here because I actually matched with this residency program, so I completed my PGY1 pharmacy residency here. I am the first graduating residency class of this program, so if you have any questions, please feel free to reach out to me. I also am the general medicine preceptor for APPE students. So I take P4s as well as residents on the medical progressive care unit, which is our progressive care unit that is pretty much ICU step down. So we take a variety of different types of patients, and I'm looking forward to meeting you guys soon.
My name is BG Rose Matthew. I'm one of the clinical staff pharmacist preceptors for the PGY1 Pharmacy Residency Program here in Advent Health Daytona Beach. I'll be your preceptor for the Pharmacy Service Commitment, which is one of the required longitudinal learning experience. Through this longitudinal learning experience, residents will learn to effectively staff the inpatient pharmacy, learn the medication use system, and prepare and dispense medications by following the best practices throughout the organization's policies and procedures. While staffing the inpatient pharmacy in different settings and shifts, and every other third weekends, the residents will work with other pharmacy team members and also develop the necessary skills to provide quality drug information to other healthcare professionals in a timely manner. Overall, the residents will be expected to establish competency and perform tasks independently to provide comprehensive pharmacy clinical services. Here at Advent Health Daytona Beach, we have a great supportive team who works collaboratively to provide safety for all our patients and positively impacts patients' hospital experience by providing high-quality pharmaceutical services. It will be our pleasure to have you on board to learn about our pharmacy and to be a successful pharmacist. Thank you.
Hey guys, my name is Sarah. I work in staffing, and I hope to meet you guys soon. Bye!
Hi everyone, my name is Yeji. I am one of the clinical pharmacy specialists here at Advent Health Daytona Beach. I cover CVICU, cardiovascular ICU, which is a 16-bed unit. So as you can tell from the name, we have a lot of patients with cardiovascular issues. The patients who come in with MI end up getting drug-eluting stent, high-risk PCI, or patients who end up getting CABG for multi-vessel disease, as well as patients with cardiogenic shocks requiring intra-aortic balloon pump or Impella and LVAD, which we do both right-sided and left-sided. I also cover half of the unit of the medical ICU, so you might have an opportunity to one of the required rotation, which is critical care, with me, and then I will also have CVICU as an option for elective. If you have any questions, you can just reach out to me anytime. My email address is yeji.lee, that's yeji.lee.com, thank you. Bye.
Hello everyone, my name is Ahmed. I am one of the pharmacist here at Advent Health Daytona Beach. So I'm the emergency medicine pharmacist. A little bit of background about me. I went to school at the University of Houston at College of Pharmacy, and then after that I completed my PGY1 at Albany Medical Center, where I had a couple of emergency medicine rotations. And after that I worked as the emergency medicine clinical pharmacist at Robert Wood Johnson in New Brunswick, and also at NYU Langone Health. I recently joined Advent Health, and the reason I love emergency medicine is the variety of disease states that you get to be exposed to every day, and the different level of acuity, from patients on like cardiac arrest to people coming in for like cellulitis, getting discharged home, others who you'll be an integral part to transferring them to the ICU with all the medications they need. So yeah, if you have any questions, please let me know. My email is ahmed.benawan@adventhealth.com. Thank you, and looking forward to talking to you about the program. Bye-bye.
Hey, my name is Debbie. I'm the operations manager here at Advent Health Daytona Beach. We are excited that you want to come and spend some time with us. You'll see me throughout your rotations throughout the whole year, and I'm here to, make your experience wonderful. Come along to Daytona Beach.
Hello, I'm Winifred Adaji, the Director of Pharmacy here at Advent Health Daytona Beach. I am so excited that you want to come and join this wonderful team. Looking forward to working with each and every one of you this upcoming year. So we go on a journey of learning, transformation, whilst we get to know each other. I can't wait for you to be a member of our team. See you soon. Take care. Bye.
Cyrene, what sets our program apart from others?
That's a great question, Adam. Well, here you go. We're actually miles away from Daytona Beach, and you can see it on one of our top floors of the hospital itself. We're also the exclusive healthcare provider for the International Daytona Speedway. We have a mix of inpatient ambulatory care experiences, and you can see those patients in the Transitions of Care Clinic. Additionally, we collaborate with the many other healthcare residency programs in Advent Health, which provides us support for research projects, MUEs, formulary reviews, CEs, acute life support certification, enterprise orientation, and allows the residents to network with other residents amongst the hospital system. Additionally, our residents get free employee parking, a meal discount, dedicated laptops in a special place of your resident office, opportunities to observe procedures, professional business cards where you can use in interviews as well as in mid-year, access to WellCare Center, which is a gym or massage on campus, a $250 wellness incentive program, financial wellness resources, 20 days of PDO, which is 10 days of just regular PDO itself, and then 10 days of project days. We also have 3 different programs for mental health, counseling, therapy, and emotional well-being, which can be either text, audio, or video. Additionally, Daytona Beach is very close to major cities around Florida, and that includes Orlando, St. Augustine, Jacksonville, and Tampa, which is just a drive away. We have many new apartment complexes that are growing around the area, and there's a massive shopping center around right the corner of the hospital, which is called Tanger Outlets. So we have many opportunities here, not just in the hospital, but in the area. We look forward to seeing you here.
Hey, Kelvin, what changes to the design of the program have we made, and what upcoming changes do we have on the horizon?
Great question. So this is very important for our upcoming residents to be aware about regarding our development as a program based off of our feedback from previous residents and our preceptors. So some of the changes that we've made recently are that we went from weekend staffing that went from every other weekend to every third weekend, and that will help a lot with residents having more time to do their research projects and their topic discussions for their rotations. Some of the other changes that have happened are that we switched our administrative learning experience from a 6-week required rotation to a longitudinal rotation. So this will give you more exposure and give you opportunity to see projects from start to finish. So all the processes and all of the steps in between, you'll be able to witness and experience. Another thing is that we added a student coordinator and recruitment coordinator role for residents. So this will give you experiences in things outside of just rotation specific, so more leadership roles as well. We added a preceptor development chair, research coordinator, and a code blue and stroke alert coordinator for the preceptors as well. So you'll have specific go-to preceptors for these specific areas. We added a teaching and learning certificate program, which is optional. So if you're interested in that field, then you can gain more experience and education in that certificate program as well. And then finally, we added a 1-hour CE, which gives you access to be able to attend and listen to all the other resident CEs across the enterprise. So we're talking over 50 pharmacy residents. So you get a lot of opportunity to learn more about topics you're interested in, as well as get practice in presenting your own CE in front of this crowd as well. So excited to see you guys and welcome.
Okay, back to me for a couple more changes that we've made for our program for the past couple years. So one is going to be that we formalized our topic discussion, so that way we're hitting every single topic that is covered in the BCPS exam, and that we're not duplicating topic discussions across our different learning experiences, since we know a lot of the disease states may overlap. We've also adjusted days that you are in clinic to make sure that you are spending the maximum amount of time with your active preceptor. So if they happen to be off on a Tuesday of that week, then you'll be in clinic with me on Tuesday. So that way you're not missing a day that you could be spending with your preceptor. We've added a formal mentor program. So in the first couple years, we just let the residents organically match with whoever they wanted to and be able to informally pick a mentor. Now we've asked that the residents do identify a mentor by the end of their orientation period. The only real requirement would be that they meet with their mentor at least once a month to discuss progress, goals, barriers, and for them to have that formal layer of support. We've also added resident self-evaluations within Pharm Academic. So you get plenty of feedback from all of our preceptors, definitely informal feedback, typically on a daily basis, more formal feedback at the end of each rotation. You have feedback Fridays on most rotations. We had your quarterly development plans. And we also think it's important for you to be able to evaluate yourself. So we've added a session on how to evaluate yourself and how to evaluate others that we will provide towards the beginning of the residency year. Then we've added formal self-evaluations at the end of each rotation, so you're able to practice that process. All right, now to Savannah. Savannah, what have some other residents who have completed our program gone on to do?
Hey everyone, so my name's Savannah. I'm from the first resident class here. I am currently the internal medicine preceptor at our program. Ooh. My co-resident, Chris, he is working in a hybrid model down in Titusville. And we had previous residents, Dakota, who also was interested in oncology. We gave him some extra time in the IV room. He actually ended up getting a job down at Moffitt in Tampa. So just a little bit about our previous residents and me.
Thank you all for watching our video. We hope you learned a lot about our program, and we look forward to seeing you soon. Bye.
Bye.